Ramiro Brito is a happy kid. He loves to play in the Brito family backyard. Ramiro and his sister Serena get along well. One reason for that is developmentally, they're not too far apart. Although Serena has a definite edge.
It's pretty clear she's more advanced than he is right now. In her speech and how she thinks, how she does things, she's just much quicker and sharper.
That would be fine, except Ramiro is almost 4 and Serena is only 2.
ABC's ready?
You can tell he's trying to form the words. He understands them, but he's trying to form them, and it's hard for him. He's just recently started to say a lot more, but I can understand him a lot better than everybody else can.
Ramiro was an undersized baby and has had oral motor problems since birth. At first, the Britos didn't know what was wrong, so they took Ramiro to their pediatrician.
I think anytime the parent thinks that there might be a delay or anytime a red flag goes off in the parent's head, they need to consult their pediatrician. It's better to find something early and catch it and maybe start the child on some kind of therapy program, if necessary, than waiting until it's much later.
Donald looked under his bed. "I found my old alarm clock," he exclaimed. But the alarm clock wasn't squeaking. It was,
Lisa Caldwell has twins, Holly and Sloan. Holly is the one you see here crawling past Lisa and her son Lewis. Holly is developmentally slightly ahead of her sister, but both of the year-old girls are a bit behind the development curve for same-age children. That's because they were born 3 months prematurely.
I just try to keep in mind personally that I can't expect them to be doing what other kids are doing their age, and I really just try to encourage and applaud what they are doing as they're doing it.
And how old would you say they were when they rolled?
Maybe 7
Okay,
months,
and so
right now.
corrected age or adjusted age 4 months, they're right on target for that.
Pediatrician Jennifer Shue has some advice for Lisa and the rest of us. Don't rush your children. That's advice the doctor follows with her own son, Jackson.
Best thing a parent can do is to allow the child to explore and to try and see if he'll sit starting at 6 months. And if he won't, don't push him, but try again maybe a few days later.
Dr. Shue has more advice for parents. Don't worry too much if you think your child is slow to develop. Children often develop at different rates, but things usually even out. Here are a few developmental milestones for growing children. Rolling over at 4 months, sitting at 6 months, crawling at 9 months, starting to talk at 1 year, toilet training and running at 2 years, getting dressed without help at 4 years, tying their own shoes at 6 years, and learning how to tell time at 7 years. Remember, these are averages, so again, don't be upset if your child is not exactly on target.
If you expect a child to roll over at 4 months, let's say, there's a normal range. Within a few months, a child may be 2 months early or 2 months late and still be within the range of normal. You need to treat the child as an individual and develop his or her own talents and skills.
Dr. Shue also says don't get upset if your child's development has been on track but then stops.
We actually do see a lot of kids develop very quickly, develop quickly and plateau. That's similar to a growth spurt that you might see in a child where they grow really fast and then they stay about the same weight and height for a little, maybe a few weeks or month, and then start back up again.
Lisa expects her daughters to catch up at about age 3.
Some of the doctors have said that basically at that point you wouldn't really see a whole lot of distinction between them and other kids their age.
Show me which one's the 7. Where's the 7?
7?
Yes! Good job!
The Britos say they're willing to work with their son Ramiro and patiently wait for him to develop at his own pace.
We encourage him the best that we can and just kind of wait and be happy with whatever happens, you know.
So when he catches up, he catches up. We're just enjoying him.